Hello, we are fourth year medical students of UKM in our ENT posting here to share about benign paroxysmal positional vertigo or BPPV. Here are our group mates under our supervisor, Dr. Hardeep. Firstly, let's talk about what is BPPV and what causes it. BPPV is a common disorder of the inner ear with symptoms including dizziness, vertigo, unsteadiness, and nausea. It is the most common cause of vertigo in people over 65 years old. It is caused by dislodged of the cornea in the semicircular canals, and this can be caused by head injury, degeneration of vestibular system due to aging, and damage caused by inner ear disorders. There are a few types of BPPV based on the location of dislodged of the cornea and can be classified into posterior, lateral, and anterior semicircular canal BPPV. The findings for each type are different, as you can see on the screen, and the most common type of BPPV is posterior semicircular canal BPPV. Females above 50 are at risk for BPPV, and modifiable risk factors include osteoporosis, migraine, head trauma, and hypercholesterolemia. Now let's talk about the pathophysiology.
Balance is controlled by our vestibular system located within our inner ear. This system is made up of 3 tubes called canals and 2 pockets called the otolith organs that contain tiny calcium carbonate crystals. Combined, they provide feedback to our brain about our head movement. Sometimes crystals fall out of the pockets and into a canal. If this happens, they can bring on a sudden brief spinning sensation. This condition is called benign paroxysmal positional vertigo, or BPPV. It's the most common vestibular disorder.
Benign paroxysmal positional vertigo is a sudden and recurrent episodic vertigo or spinning sensation. The symptoms of BPPV is triggered by quick rotation of the head relative to gravity. As an example, any position change such as lying down in bed or getting up from bed quickly. And these symptoms typically last several seconds, usually less than a minute. It is also associated with nystagmus, risk of falls, nausea, and vomiting.
Now we move on to investigation and treatment. This condition can be diagnosed clinically by history-taking and bedside examination. Dix-Hallpike test is a diagnostic maneuver that can be used to diagnose BPPV. It also can confirm the affected ear.
This video shows a fast version of the Dix-Hallpike maneuver. You may pause the screen and read the instructions to know further on how to do this maneuver.
This condition can be effectively treated with canalid repositioning by doing this maneuver. Number 2, vestibular rehabilitation. Number 3, medications such as vestibular suppressants that mainly involve anticholinergic, antihistamine, and benzodiazepines. Number 4, surgery. And lastly, lifestyle changes by avoid provoking position and low salt diet. In contrast to Dix-Hallpike test maneuver, this maneuver is a simple head movement that can be used to treat BPPV. It involves reposition the otocondylar debris from posterior semicircular canal back into the utricle, and it consists of 5 positions with pause about 30 seconds in between.
This video shows a fast version of this maneuver. You may pause the screen and read the instructions to know how to do this maneuver properly.
So for the complications, the first is nausea and vomiting. Second is canal conversion, which is quite rare, which is a canal switch benign paroxysmal positional vertigo. Refers to the phenomenon in which otolith particles move from one canal to another on the ipsilateral side during or after the canalid repositioning procedure. And last is fainting. In summary, BPPV is a common disorder of the inner ear with symptoms including dizziness, vertigo, unsteadiness, and nausea. And BPPV can be diagnosed using the Dix-Hallpike maneuver and treated with the Applis maneuver.